After a quick introduction, I'll demonstrate the iSALUS unified EHR and billing software with unique features designed specifically for mental health providers. Let's start by reviewing some ONC stats from a recent behavioral health roundtable. According to the ONC, by 2009, almost 20% of adults in the U.S. had suffered from a mental health condition at some point in their lives. And in 2010, 23 million people ages 12 to 64 reported symptoms of substance abuse, yet only 11% received treatment at a special facility, which might have been attributed to a shortage in insurance coverage. And since 32 million new patients will have insurance coverage with the advent of the Affordable Care Act, mental health providers are seeking ways to run smarter, more efficient practices so that they can keep up with the growing demand of new patients without burning themselves out. But they've hit a wall with EHR vendors that don't understand they're different. Their lower patient volume means that they can't afford expensive software, and they need critical features like DSM-5 coding compliance, strong prior authorization tracking, and the ability to share notes or even share patient charts with primary care physicians. Now I'll take the role of a therapist or a psychologist and show you how our unique mental health specific features can help you deliver better care. We'll start the demo by reviewing a couple of the several thousand mental health templates we've built. We're starting with an ADHD template. And next we'll take a look at a template designed for anxiety. And these are all DSM-5 compliant. And here's a depressed mood template. And new mental health customers can choose from our thousands of templates, or you can have us build custom templates from the ground up. And here's a substance-related template. Now we'll transition to the appointment scheduler. We'll start by looking at the therapist's weekly calendar view. After establishing a care plan, both your patient and your scheduling staff might find it beneficial to schedule follow-up appointments at the same time each week. This is really easy to do. You just right-click on the calendar and you select Appointment Recurrence. And these appointments can end after a number of occurrences or end after a specific date. In this case, we're going to go ahead and schedule a weekly recurring meeting with this patient through the end of 2014. Now, we'll move to one of the most important aspects of mental health, authorization tracking. iSALUS will automatically warn you when an authorization is approaching the end. iSALUS lets you track authorizations by almost any data points. You can track by start and end date, number of visits allowed, dollar amount allowed, number of units allowed, and even the procedure and diagnosis code combinations. Now as we check this patient in, watch the alert that pops up reminding us about the authorization. You can tell this was designed for mental health. Now I'll show you how easy it is to export appointments so that you can import them into a third-party tool for appointment reminder phone calls. It only takes a few clicks and a few seconds. And we're done. Now let's go into the EHR and review the patient's chart. As a therapist, although I'm not prescribing medication, I do need to be able to review medication quickly and efficiently. And iSALUS makes it extremely easy to review medication and mark as reviewed. And our award-winning patient timeline allows you to review previous prescriptions as well as who wrote the prescription. You can open and review previous chart notes. And by hovering over them, I can see the last date and time of a note. Let's open and review one. Here you can see we had a therapy progress note tracking today's feelings and depressed mood. The patient timeline also shows all previous communication you had directly with or internally about a patient. Here we can see internal communication about what happened after the patient called. And this transparency for all providers to see what's happened with a patient really improves care quality. The free and secure My Medical Locker patient portal allows providers to send and receive secure messages to and from patients right from the comfort of your EHR. We're going to send this patient a secure message. It's as simple as email, but it's backed by HIPAA-compliant security. And when we're done, it's as simple as hitting send. Now we're going to chart a visit as a therapist. We'll go to the Exams tab. And as a therapist who sees your patients frequently and on a recurring basis, iSALUS lets you copy forward previous templates and edit to fit the current visit. In doing so, your documentation will stay rich and robust as well as current and relevant. Notice how everything that was typed or selected is brought forward in its original form. Now, you simply update based upon the current information and add any new details. For example, in this case, we'll update the time in and time out. We're also going to read through the note and make the appropriate changes where applicable. As I read this, I remember that Michael, the patient, actually has in fact found a gym based upon my recommendation to go out and exercise. So I'm going to go ahead and update this now. And since he's feeling better, I'm going to go ahead and document that. I'm also going to refresh my notes as it relates to the patient's post-divorce dating life. And now we're going to scroll down and start to track Michael's responsiveness and progress as it relates to DSM-5 compliant questionnaires and outcome measurements. And we'll update our mental status template indicating that the patient is friendly today. Change that the speech was not slow, it's actually normal today. As we continue to review each section, we're ultimately confirming that each of these is accurate or making updates. And we're updating our mental health rating scales. Next, we're going to open a depressed mood template. And since iSALUS has been building mental health templates for about 15 years, we have thousands of these. Now, we want to see the outcome data over time, so we're going to open flow sheets. This shows that each date that we provided the questionnaires along with their respective answers and allows us to simply check the boxes next to the test in order to graph these out over time. In this case, it appears that with treatment and time, Michael's depression is really beginning to improve. Now we can graph our results. We will now move to the problem list, which displays all of the conditions that this patient has been diagnosed with. We can see the diagnosis code, the description, related dates, and any pertinent notes. And we can go ahead and open and modify. And we can also add a note about the dropping BDI score. And iSALUS has an integrated and unified EHR and billing application, which means that you sign in with a single login. This is not two systems designed or forced to work together, it is a single system. And with all the documentation we completed, we will input a super bill that will be submitted for billing. iSALUS does provide you with all of the tools necessary to document and code in lockstep with the new DSM-5 mental health standards. and upon completion of the superbill, it does go directly to the clearinghouse for billing. The very last step in the process is to pull all of the information that you've recorded into a single document. Once you've had a chance to review, you input your 4-digit PIN to sign off on the note and add it to the patient's timeline. Once you're done with the visit, you can fax a copy of the patient's SOAP note to the primary care physician with a single mouse click. Or, if you feel like the primary care provider needs more than just a fax, you can share the patient's entire chart with them for free using ChartShareMD. And they can even put comments on that chart that flow back into you. And the last thing I want to show you is the clinical analytic perspective of iSALUS. In this case, we will find all patients that have a score of 30 or higher on the Beck Depression Inventory Scale. We will simply open the iReport and add our search criteria. Once the criteria is added, we will decide what data points are returned for the patient, such as name, age, gender. For our purposes, we will also include race, ethnicity, and marital status. With this list returned, we can easily report as well as further analyze the information in Microsoft Excel. And once we're done building the report, we will select Search for Patients. And so this is our list of all patients with a score of 30 or higher on the Beck Depression Inventory Scale. And once we have this information, we can either send all of them a letter if we like, or we can push the information into Microsoft Excel for further analysis. And this concludes the end of our mental health charting demonstration. I thank you for joining us.